Question 1. What is the role of the anterior pituitary in the endocrine system? A. Stores ADH and oxytocin. B. Releases hormones to regulate other glands. C. Produces melatonin. D. Controls voluntary muscle movement. Answer. B. Releases hormones to regulate other glands. Question 2. Which condition results from an overproduction of antidiuretic hormone ADH? A. Diabetes insipidus. B. SIAD. C. Addison's disease. D. Graves' disease. Answer. B. SIAD. Question 3. What hormone primarily increases blood glucose by promoting gluconeogenesis? A. Insulin. B. Glucagon. C. Cortisol. D. Epinephrine. Answer. C. Cortisol. Question 4. What is the nurse's priority intervention for a patient with newly diagnosed type 1 diabetes experiencing nausea and rapid breathing? A. Administer antiemetics. B. Encourage oral fluids. C. Check for ketones and notify provider. D. Administer long-acting insulin. Answer. C. Check for ketones and notify provider. Question 5. A nurse notes positive Chvostex and Trousseau signs. What is the likely electrolyte imbalance? A. Hyperkalemia. B. Hypokalemia. C. Hypocalcemia. D. Hypercalcemia. Answer. C. Hypocalcemia. Question 6. What hormone stimulates the adrenal cortex to release cortisol? A. TSH. B. GH. C. ACTH. D. LH. Answer. C. ACTH. Question 7. A patient with suspected Cushing syndrome is being evaluated. Which finding supports the diagnosis? A. Low blood glucose. B. Hypotension. C. Thin extremities and central obesity. D. Dehydration. Answer. C. Thin extremities and central obesity. Question 8. A nurse caring for a patient with thyroid storm should prioritize which intervention? A. Administer aspirin. B. Reduce environmental stimulation. C. Encourage ambulation. D. Give warm blankets. Answer. B. Reduce environmental stimulation. Question 9. Which hormone deficiency leads to decreased reabsorption of water in the renal tubules? A. ADH. B. Aldosterone. C. Insulin. D. TSH. Answer. A. ADH. Question 10. What should the nurse monitor for in a patient receiving radioactive iodine therapy? A. Bradycardia. B. Hypothyroidism. C. Hypercalcemia. D. Increased appetite. Answer. B. Hypothyroidism. Question 11. Which gland is located on top of the kidneys and secretes corticosteroids? A. Pituitary gland. B. Thyroid gland. C. Adrenal gland. D. Pancreas. Answer. C. Adrenal gland. Question 12. A nurse notes a patient with a fasting blood glucose of 58 milligrams per deciliter. What is the best initial response? A. Document the finding. B. Recheck in 1 hour. C. Provide 15 g of carbohydrates. D. Call the healthcare provider. Answer. C. Provide 15 g of carbohydrates. Question 13. Which hormone works to decrease blood calcium levels? A. PTH. B. Cortisol. C. Calcitonin. D. Glucagon. Answer. C. Calcitonin. Question 14. Which finding should a nurse prioritize in a patient with diabetes and autonomic neuropathy? A. Dry feet. B. Orthostatic hypotension. C. Slightly elevated A1C. D. Cracked skin on heels. Answer. B. Orthostatic hypotension. Question 15. Which lab result is expected in a patient with hyperparathyroidism? A. Low calcium, high phosphate. B. high calcium, low phosphate. C. Normal calcium, high potassium. D. Low sodium, high glucose. Answer: B. High calcium, low phosphate. Question 16. A nurse observes a thyroidectomy patient with hoarseness and difficulty speaking. What is the next step? A. Encourage coughing. B. Document as expected. C. Assess for airway compromise. D. Suction the airway. Answer: C. Assess for airway compromise. Question 17. A patient taking levothyroxine reports weight loss and insomnia. What is the best nursing action? A. Discontinue the medication. B. Notify the provider for a possible dose adjustment. C. Increase fluid intake. D. Encourage rest periods. Answer: B. Notify the provider for a possible dose adjustment. Question 18. What does the zona glomerulosa of the adrenal cortex primarily secrete? A. Glucocorticoids. B. Androgens. C. Catecholamines. D. Mineralocorticoids. Answer: D. Mineralocorticoids. Question 19. What hormone stimulates release of milk during breastfeeding? A. Prolactin. B. Oxytocin. C. Estrogen. D. FSH. Answer: B. Oxytocin. Question 20. A diabetic patient asks why hemoglobin A1C is important. What is the best response by the nurse? A. It shows your current glucose level. B. It reflects how much insulin is in your blood. C. It measures long-term glucose control. D. It checks for ketones in your blood. Answer: C. It measures long-term glucose control. Question 21. A nurse is monitoring a patient with SIADH. Which urine output pattern is most expected? A. Polyuria with dilute urine. B. Oliguria with concentrated urine. C. Polyuria with concentrated urine. D. Normal output with dilute urine. Answer: B. Oliguria with concentrated urine. Question 22. Which part of the adrenal gland secretes catecholamines? A. Adrenal cortex. B. Zona fasciculata. C. Adrenal medulla. D. Zona reticularis. Answer: C. Adrenal medulla. Question 23. Which endocrine disorder is associated with truncal obesity, moon face, and purple striae? A. Addison's disease. B. Cushing syndrome. C. SIAD. D. Hyperthyroidism. Answer: B. Cushing syndrome. Question 24. A patient with diabetes has hot, dry skin and extreme thirst. What should the nurse suspect? A. Hypoglycemia. B. Diabetic ketoacidosis. C. Hyperglycemia. D. SIAD. Answer: C. Hyperglycemia. Question 25. Which hormone is responsible for regulating metabolism? A. TSH. B. Insulin. C. T3 and T4. D. ACTH. Answer: C. T3 and T4. Question 26. Which symptom requires immediate action in a patient taking methimazole? A. Weight gain. B. Rash. C. Fever and sore throat. D. Sleepiness. Answer: C. Fever and sore throat. Question 27. Which hormone controls the release of FSH and LH? A. GnRH-BD8. C. Prolactin. D. Estrogen. Answer: A. GnRH. Question 28. A nurse is reviewing labs for a patient with Addison's disease. Which finding is expected? A. Hypernatremia. B. Hyperglycemia. C. Hyperkalemia. D. Hypocalcemia. Answer: C. Hyperkalemia. Question 29. What is the physiological effect of parathyroid hormone? A. Decrease renal reabsorption of calcium. B. Increase calcium absorption in the intestines. C. Stimulate release of insulin. D. Promote glycogen storage. Answer: B. Increase calcium absorption in the intestines. Question 30. A nurse is caring for a patient with diabetes insipidus. Which 4 fluid is most appropriate? A. D5W. B. 0.9% normal saline. C. 3% hypertonic saline. D. 0.45% saline. Answer: D. 0.45% saline. Question 31. What is the expected effect of aldosterone on blood pressure? A. Decreases it by causing vasodilation. B. Increases it by water and sodium retention. C. Lowers it by potassium retention. D. Has no effect on blood pressure. Answer: B. Increases it by water and sodium retention. Question 32. A nurse evaluates a patient with suspected pheochromocytoma. Which diagnostic test is relevant? A. Serum cortisol. B. 24-hour urine for catecholamines. C. Fasting glucose. D. Serum prolactin. Answer: B. 24-hour urine for catecholamines. Question 33. Which symptom is most characteristic of hyperthyroidism? A. Bradycardia. B. Cold intolerance. C. Weight gain. D. Heat intolerance. Answer: D. Heat intolerance. Question 34. What time of day is cortisol level normally the highest? A. Early morning. B. Noon. C. Evening. D. Midnight. Answer: A. Early morning. Question 35. A nurse prepares to give Lispro insulin. When should it be administered? A. At bedtime. B. 30 minutes before meals. C. Immediately after eating. D. Within 15 minutes before meals. Answer: D. Within 15 minutes before meals. Question 36. What is the role of the hypothalamus in the endocrine system? A. Secretes insulin. B. Regulates pituitary hormones. C. Stores oxytocin. D. Produces cortisol. Answer: B. Regulates pituitary hormones. Question 37. What should the nurse monitor for in a patient receiving fludrocortisone? A. Hyponatremia. B. Hypokalemia. C. Hypoglycemia. D. Bradycardia. Answer: B. Hypokalemia. Question 38. Which symptom is a red flag in a patient with diabetes experiencing hypoglycemia? A. Headache and hunger. B. Irritability and confusion. C. Thirst and dry skin. D. Blurred vision and polyuria. Answer: B. Irritability and confusion. Question 39. A patient with acromegaly is being evaluated. What is the likely cause? A. Excess TSH. B. Growth hormone secreting tumor. C. Pituitary hypofunction. D. Thyroid nodules. Answer: B. Growth hormone secreting tumor. Question 40. A patient with primary hypothyroidism is receiving levothyroxine. What lab value indicates effectiveness? A. Decreased TSH. B. Increased TSH. C. Low T3. D. Low T4. Answer: A. Decreased TSH. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.